Well, hello, and welcome to another edition of JC Lee MD Brainstem 101. On this sub-channel, I talk about primarily transcranial magnetic stimulation and other brain stimulation interventions in psychiatry, this new branch of so-called interventional psychiatry. Well, today I'm going to endeavor to just explore that topic or that question of can psychotherapy be combined with something more procedural, such as TMS, in order to amplify response? And of course, this is a very broad topic, but you can imagine a lot of people are interested in this concept of neuroplasticity, and of course, the purported benefits of TMS in major depressive disorder, at least, are thought to be, sort of the induction of neuroplastic changes in different cortical and cortical striatal, sort of networks, brain networks. And incidentally, some of these networks are also targeted by specific psychotherapies, such as cognitive behavior therapy, or CBT, which is generally considered first line, at least in the States, for major depressive disorder. Now, TMS, tends to be quite decent in terms of affecting response and remissions. A response in scientific studies is a greater than 50% reduction in depressive symptoms from baseline. So, if you start with an arbitrary number of, 100 out of 100 on some scale, a response would be, an ending scale measure of like 49 or less, right? So greater than 50% reduction. Remission, on the other hand, is that idea of essentially no longer meeting criteria for depression. So no longer meeting that minimum threshold of at least 5 symptoms out of 9 for a sustained period of 2 weeks or more with impairment in functioning. And so these are two kind of outcome variables that can determine, the general effect of a certain treatment. Now, Donse and colleagues in 2018 published a paper in Brain Stimulation where they looked at concomitant psychotherapy with TMS. And so this was a naturalistic study. It was not controlled. It was really looking at effectiveness and outcomes in different clinics that essentially delivered either high-frequency left-sided TMS or low-frequency right-sided TMS, or some combination, sequential bilateral treatment of both, while psychologists sat across from the person in the TMS chair and attempted to deliver cognitive behavior therapy, or in some cases, different variations of EMDR or other kinds of specific symptomatically focused psychotherapies. And so what they found was that although general standalone effects of RTMS in depression and treatment-resistant depression might have, sort of benefits of about 37 or 40%. When they looked at this, set of 200 or so people, I think it was 196 patients who were run, 98 females and 98 men, what they found was a higher than that response and remission rate. The response was something like 2/3, 60% or more, and the remission was about 56%, if I remember correctly. And in fact, what I was quoting before, the 37, I believe, is more speaking to remission rates, not response rates. So I apologize for that misnomer. And so what they found was essentially 2/3 of the people who were running through this kind of treatment, this combined treatment, were getting better. Now, of course, they didn't do any statistical analyses to compare their data with previous data. And of course, because this is an effectiveness or like uncontrolled kind of trial, it wouldn't have been, fair to compare apples to oranges or people from previous trials anyways. But the numerical, percentage of responders and remitters seem to be, at least at face value, higher when you combine CBT with TMS. Now, does that mean, it's worthwhile trying to book both your TMS psychiatrist and a psychologist on hand? Well, some would say that, there's a certain state-dependent reactivity of the brain, or, suppleness that can be engendered with TMS that might combine really beautifully with, psychotherapy on top of that. Pragmatically, I mean, I gotta say, delivering therapy with, something that sounds like ongoing. I'm not really sure how pragmatic that is. But as a clinician and also as a former academician, I think what I've taken from this study and subsequent ones is that, you know, what we focus on during TMS may matter. And that's to say, you know, people who are watching Criminal Minds or CSI during their TMS treatment may find that their treatment is somewhat blunted in comparison to those who are watching Schitt's Creek or the great British baking show and the like. And so often what I will encourage people to do is to bring notes from their therapy sessions or to bring any psychotherapeutic or bibliotherapeutic books to the treatment session, so that while they are sitting in the chair, while their brain is actively being stimulated by TMS, they can be engaging different networks that can allow them to expand their emotional resilience and health. For this and other news out of the ivory tower, feel free to click like and subscribe for further updates of this sort. And thank you so much for joining me. Until next time, love yourself.